Hello, I'm Dr. Carlos Santo, medical advisory to Soul CBD and naturopathic physician practicing in the state of Arizona. Since 1997, I have seen a number of acute and chronic illnesses come through our door. And like true for any holistic physician, we always use whatever is in the best needs and interest of the patient to help them out. And nothing has been more the case since the enactment of the Medical Marijuana Act in 2011, where now we opened up a whole new world for people to access the magical benefits of this healing plant. And I have to be honest with you, full disclosure, I was initially very opposed to the enactment of the law because I had this preconception about it being federally illegal, and of course people just want to get high, and the common assumptions that people were making about it. But it didn't take long for me to start seeing these results in my patients. They were quite impressive. I was seeing people come off of disability going back to work again. I mean, we're talking grandmothers who would never think of smoking this stuff or anything like that. Pretty funny. But then I came to realize that just like any other herb, this is a very healing plant. And I did know intuitively that the plant has been very healing for a number of reasons, and of course since the dawn of time, just like so many other plants out there. So why not have access to this healing plant? And it didn't make any sense to me. So I started seeing, the results in my patients. It's been quite impressive. Like I said, people getting back to work again, getting on their feet. Most importantly, coming off the very toxic pain meds, oxycodone, OxyContin, Percocet, Percodan. We want to see people come off these because they're highly addicting. And I've always known as well, not just intuitively, but scientifically, that the abuse potential for marijuana is very low, despite what the scheduling of the DEA suggests. And there's a lot of work right now being done to try to get marijuana descheduled off a Schedule I drug, because technically it doesn't fall under that jurisdiction. For instance, there's a lot of research that shows the medicinal benefits of cannabis and its various forms and extracts. And for that reason alone, it should not be a Schedule I drug, because there are medicinal benefits. To that point, we're here to speak about CBD, cannabidiol, which is a really up-and-coming, in the scientific world, area of focus, because CBD, cannabidiol, has incredible healing benefits for a number of bodily systems without causing the high that its bigger brother THC causes. And that's really, really encouraging, because we want to have access to these extracts for children, for instance, with epilepsy, where a lot of the research is showing benefit, or perhaps for the elderly, who again, because of cognitive decline, can't risk having any type of substance that's going to impair cognition or memory, or for instance, more specifically in a Parkinson's or Alzheimer's patient, who can again not risk having anything that's going to impair their mental cognitive function. This is why we're looking at CBD, because it expressly does not result in the detraction of mental acuity and focus. Not to say that THC does do that. However, when concentrated too high, as in certain strains or extracts, THC definitely will cause that euphoric effect. And we're trying to avoid that with the CBD. And that's the exciting thing. Now, people might wonder, well, what's going on? How can we extract out CBD? And in the case of Soul CBD, how are they doing it to create it into a nutritional supplement? How are we getting through the law here? And this is the exact same way that we've been using hemp for nutritional products for many years. I mean, hemp protein powders are available at many health food stores, you might find, and hemp soaps and other types of hemp oil, for instance, an amazing source of omega-3 fatty acids, vegetarian source. Well, the sourcing comes from outside the country. When brought in for the purpose of a nutritional product, not for a drug, then it certainly is legal to use. And this is where the direction of a lot of the companies are going right now. American-based companies getting it from outside the country, bringing it in, and then concentrating it down to the desired effect, whether it be capsule, oil, sublingual troche, or something like that. Topically even, we're seeing results with it. That's the nice thing about it. And now we're at the precipice of science and technology, maximizing the effect of drugs while minimizing their side effects. Imagine being able to take a chemo drug that we know will target a particular tumor, but at only 1/100th of a necessary dose to get that drug to the target site. Well, you can pretty much intuit, without knowing too much science, that we'd maximize effect and minimize toxic effect and ultimately side effects. That would be the ideal circumstance. And the nice thing is we're looking at a number of drugs right now, not just chemo drugs. For instance, COX-2 inhibitor, that are normally, or COX-2 inhibitor class drugs, which are normally associated with heart attacks. However, they are very, very effective at reducing pain and inflammation. And so patients like them, but of course we can't give them to them because of these horrible side effects. Now we'd be able to, because we can increase the delivery at a fraction of the concentration, and then minimizing or mitigating completely those unwanted side effects, in this case heart attacks and COX-2 inhibitors. Well, we're also able to do this with CBD. Even though CBD is not psychoactive, we still want to ultimately, in good faith to the public, reduce the amount necessary to get to the target site. And this couldn't be the case more than for the fragile people, say, who are really convalescing during or recovering from a severe illness, or the elderly, or infants and children who could benefit from this. Minimizing the necessary dosage, maximizing the effect at the target site, in this case the CB2 receptors, is the ideal circumstance. And this is where Sol CBD really stands out in industry. This is very exciting, folks, because nanotechnology coming together with medicine, with herbology, with nutraceuticals is where we're headed in the future, because we're all needing greater and greater ways to keep ourselves healthy in a challenging world. We're exposed to GMOs and toxic pesticides, et cetera, et cetera. And so here we are maximizing the benefits of science, taking it to our fullest genetic potential, helping us live well beyond the generations past and into our 80s, 90s, and 100s, but not just living longer, but being vital and healthy. And this is where we're headed. And I'm really loving being at the forefront of this research. Some closing thoughts here. Wonderful that so many states are showing the push toward legalization of medical marijuana. I love that it's legal for medical use. And while I have other opinions about the recreational use, that wouldn't be appropriate here in this segment. But this is the good news. And on the federal level, if we can deschedule cannabis and make it a non-Schedule I drug and make it available and recognized in the full medical community for its full healing potential, then we're all going to be better for it in the future. I thank you very much for your attention, and I look forward to speaking to you again soon. Dr. Carlos Santo, checking out.